Let's talk about lip filler, if you should ever get lip filler, and if you shouldn't get lip filler, what should you do instead? Well, first off, I want to say I'm not an absolutist saying you should never get lip filler. My message is much more. Most of what you probably want to improve about your lip, especially your aging lip, is not fixed by filler. It's not the best option to do it. It's very misguided to do it that way. And we see the consequences of this with a lot of really funny looking lips around right now. Filler does augment, it adds volume. It's an implant in the lip. So if you're 20 something years old and you just want bigger lips, you want an augmentation alone, that's where filler can do that. The issue is it's just so often overdone and can create problems down the road. Most of the time people are wanting to manage an aging lip. What's happening as your lip ages? Well, it does lose some volume, a very small amount of volume. There's a surprisingly small amount of actual fat in the lip, in our pink part of our lip itself. That's not what's really happening there. And our lip's very unique in that it's a free floating fat pad. It's not sitting up against a bone exactly like a lot of our other fat pads are. So there's muscle, there's skin, there's a little bit of fat, there's mucosa, which is like the lining of the lip that sits in there. That's what's creating the positioning of a lip. The lip is also very uniquely suspended partially from the nose area above, and on the outside corners, the part that most people are really concerned about when their corners downturn, that's suspended from our face more. So we have the subnasal lip under the nose, the subfacial lip under the face. So what do we do as all these parts age together? Even the lines above the lip, that's the area that commonly filler is used, and that's very, very, very misguided. That's a qualitative change. That is a skin-based change and a fat pad-based change, and what's happening above the lip in an area that moves a lot. Our lip is meant to move. It's one of our main methods of nonverbal communication. It's quite literally one of the key elements of how our neuroanatomy tunes into faces to see what they're doing from an emotional and a communication standpoint. They move a lot. So that skin and those fat pads start to break down. They're not losing a bunch of volume. This is structural, this is qualitative, which is why I often say in those particular areas, something like a resurfacing laser focused on restoring collagen and elastin to that tissue is so much better than trying to put gel inside of each line. That creates problems, migration, it moves around, it's the wrong strategy. Extra benefit if with your resurfacing laser, you're using some of the regenerative components of your own fat via nanofat or whatever it may be, because now you can treat in multiple layers. You can treat the skin surface, you can improve the qualitative aspect, the collagen, the elastin, and help to restore some of the structure of the subsurface of the fat that lives right below that. That is your answer for something like a lip line above the lip, which filler is commonly used for. The other thing is a lip lifting surgery. Now, interestingly, I don't push these a lot. This isn't something that with every even facelift that I'm doing, I'm saying, oh, you need a lip lift as well. It's often a conversation that goes along with it, what to do with that, because there usually is some gravitational aging that happens in the lip as well. There usually is some sinking of the lip, but it's more than just lengthening and sinking. It's inversion of the lip rolling in and exposing less of its pink portions, and often some asymmetry forms from side to side. That could be from some skeletal asymmetry that underlies just in our bony skeleton, or it could be from years of asymmetric movement, which is really, really, really common. The two sides of our smile aren't quite the same. And so with that, you have the gravitational changes of the face, you have asymmetric muscle movements. So it is not uncommon that one side of the lip, especially at the outside corners, is lower or moves different than the other one does. When we talk about this surgical option to actually lift the lip back up into place, we are talking about changing the physical height of the lip, sometimes, not all the time. We're talking about re-everting the lip, showing the volume that is already there. This is what's usually missing. People think they have a small lip, but a lot of the volume has just rolled in, inverted, and it's no longer sort of appropriately stacked on top of itself. It's all there, it's just in the wrong places. And improving the symmetry, especially at the outside corners. And there's specific ways we do this with different types of lip lifts. Some have a very specific corner focus on them. So a lip lift is an okay name, but it really involves height, eversion, and symmetry and positioning of the lip that goes with it. Even with that, it's definitely a conversation point with most people where I'm trying to find if it's the right procedure for them. Just because you can do it doesn't mean you should do it. I'm trying to balance it with what's happening with the rest of their face. And for me, I'm really, really looking at the movement of their lip, because my unique lens, really focusing on the neuroanatomy, the neurobiology of how we interpret faces, I want the lip to be moving in an optimal way in the long term, which is a side note as to why I don't love using things like Botox in the lip either for those vertical lip lines, because you're taking away some of our ability to express or emote in those areas by taking that movement away. That gets to the last ingredient, which is volume, because there is some volumetric change and shift in the lips. Fat transfer is an option for that, but it's not perfect either. You can only do so much fat transfer to the lip because, like I said, the lip only at baseline, even in youth, only has a very small amount of fat in a very specific location in there. You don't want to overdo fat transfer in the lip because it can change the look of the lip based off of how light reflects off the lip and make things look a little bit more yellow and less red. The red is very important in that part of our lip, and it's there for a very important reason, which is because of the blood vessels that exist under there. This is one of the ways that filler can cause issues, because filler inflammation can blur the lines where the white and the red part of our lip are supposed to have a nice distinct junction between them. We want the white part of our lip to be white and we want the red part to be red, or we want the pigmented portion of our lip to be pigmented and the non-pigmented to not be. We want those to work together with a nice solid line between them, and filler can blur that by creating some inflammation and creating vascular supply. But just the straight up most common issue with filler in the lip is that it can only hold a very small amount. When I say a small amount, I'm talking very small, maybe 0.3 millimeters, something along those lines. There's some emerging evidence to come out that that's about the amount we should put in the lip. And so when we think about what's actually done in real life and real practice, very rarely, way less than 1% of the time, is somebody actually getting that amount of filler volume in their lip. They are getting 3 times that easily most of the time, and that's causing issues, migration, unnatural looks. You pair that with the idea that you need to repeat that treatment, which is really common in the lip, so we let it stretch out and then we have to do it again. It can only tolerate so much at once. Very flawed logic that creates issues. It creates funny looking lips that don't move normally, and it was misguided from the get-go, because volume is often not the main thing that people are after. The volume is there. It needs to be everted. The vertical lines don't need filler to address them. There's all these other options that go into it first. When we look at the lip as a whole, just like we should our face, we want to look at the baseline position. We want to look at the movement. We want to look at how everything is stacked together. And when all is said and done, when we're through everything, we want things in a beautiful, rested position. We want things to move normally and naturally without strain. And we certainly don't want to be setting off things in our head, alarms, if you will, from our neuroanatomy that looks off, that's not quite right, and we get distracted, or we distract other people in this case. We're trying to figure out exactly what's going on with our lips and our mouth. And when you really think about it, that's a really common scenario that happens all the time. So it's a really customized approach to what to do for your lip. So the lip ages, filler's often misguided in what to do there. There are other options to do them. Just because you can doesn't mean you should, though. And there are long-term regenerative ways to address some of the qualitative changes that can really move the needle without having to do surgery and still leave your lip moving and looking normally when all is said and done.